surgeon, and I am here trying to answer some questions on sports injuries. I am a orthopedic surgeon in Houston, Texas. I focus on sports injuries of the shoulder, hip, and knee. And right now, I have a couple minutes after operating to answer some questions about any sports injuries of the shoulder, hip, and knee. Thank you for joining. I see we have some people here already. Masked Pitbull, thank you for supporting me all these years. Thanks for your funny questions. Yes, I'm fellowship trained, as you know very well, because you helped train me in LA. So I'm glad you're here joining me. Thanks, everybody. Let's get started in a second. And typically I answer some questions. And in general, if I don't answer your question, please feel free to comment somewhere else or DM me to get your questions answered if I don't answer on this forum, because sometimes I get a lot of questions if I can't get to it. But thanks for joining so far. And I'm just going to start off with the first question. Suleiman, thanks for asking a question. I want to be an orthopedic surgeon. I'm a rising sophomore in high school. Any advice? So I would say being an orthopedic surgeon is definitely a great field to be in, and I enjoy doing it. Definitely starting early is great. I'd say even if you're in high school, it's good to have an interest in it, but I'll keep your options open definitely early on, especially in high school. But the important thing to do is to just do well in school, do well in extracurriculars, and I think everything will kind of fall in place as long as you work hard. Thanks for your question. Ian asks, how has torn Achilles surgery improved? The surgery for Achilles tendon has had a little bit of improvement over the past several years, and that main improvement is minimally invasive techniques. Basically, one of the techniques that we use now is called a partial, it's a percutaneous technique where we put needles through the tendons, through the skin, and it allows the tendon to be repaired without making a big incision. The benefit of that is that there's not a big incision to heal from, and there's less theoretical risk of infection. Although some of these techniques have improved the recovery time because some of the techniques allow for anchors to be placed, and some theorize that that might give more tendon strength and improved ability to have higher loads early on, such as what I'm blanking on the name. Aaron Rodgers underwent this Achilles technique, and some people think that it may allow for quicker return to sport. So all that needs to be kind of borne out in studies, but the biggest improvement has been the percutaneous technique that they use now. Thanks for your question. Mass Pitbull asks, what are your thoughts on quad tendon autograft ACL reconstruction? Also auto versus allograft. So that's an excellent question. Thank you for that. I actually prefer quad tendon autograft for most of my ACLs. Typically, I do it because it has a very strong and thick graft. Thickness of the graft is one of the most important indicators of the strength of the graft, because what you're looking for is a good cross-sectional area of the graft. And a quad tendon graft is very reliably a thick graft. And my preferred technique involves an ACL reconstruction with a quad tendon. There are other grafts that could be used, such as the hamstring, the patella graft, and allograft. So allograft is from a cadaver. I typically don't do a cadaver graft unless the patient is older and is not as active, because it has had the tendency to have more ruptures in younger and active individuals. But thank you for that question. I'm going to skip around to some other questions here. Giovanni says, if I get ACL surgery at 15, will it stunt my growth? So that's a great question. It all depends on where your growth plate is and how open your growth plates are. when I do surgery in patients younger than 15 or 14, I always take a look at their growth plates. Also, you want to know how much growth they have remaining, because some people, they may have open growth plates, but if they have a little bit of, or not much growth remaining, which you can determine sometimes with other types of x-rays. If they don't have a lot of growth remaining, then they can have a normal ACL. However, thanks for the sunglasses, but however, they can have, if I do an ACL on a younger individual with open growth plates, I never use any bony grafts, because you don't want to put bone across the growth plate, because that definitely will affect the growth of that bone. So bottom line is, you can have ACL surgery at 15, and you just have to know how much growth is remaining, and you have to use special techniques as well sometimes. So I'm gonna skip around some questions. So there's a couple questions about Oscar sliders. I'm gonna skip around. A lot of people have been asking about Oscar sliders. So Oscar sliders is basically a condition that affects the insertion of the patella tendon on the shin bone. And it is more common in adolescents around 13, 14. And it typically goes away after the growth plate closes during growth. So that is around 14 for girls and 16 for boys. So it can take that amount of time sometimes to go away. And the pain from Oscar sliders is usually worse with running, jumping, and other explosive activities of the knees. So I'm going to skip around. So Nick asked, can you repair a torn ACL and a damaged meniscus in the same procedure? Yes, you can. Typically ACL injuries do have damaged meniscus or meniscus tears at the same time. And therefore, we do perform meniscus surgery at the same time as an ACL surgery. So that's a very typical ACL and meniscus pattern to have. So Recom 12 keeps asking about questions that I'm not seeing your question. So please ask your question again. I'm sorry if I missed your question again. If I don't answer your question, please send me a DM. So Sparse Sleep says, why do doctors treat nurses so bad? Sorry if that happens, or if you see that happening in the hospital. Definitely, it is no excuse from a doctor standpoint, and I can't kind of answer for any other doctors. Lex Talamis Photographer says torn rotator cuff. So torn rotator cuffs are very common, especially as we age. And I typically treat a torn rotator cuff with physical therapy at first. If it's not any better with physical therapy and the patient has significant problems, I then ask them if they want surgery, if their function is bad enough to warrant it. But usually physical therapy can improve a lot of people's injuries and a lot of people's pain, but there's a subset of people who have significant pain and a severe tear that gets better with a surgery to repair the rotator cuff. And I do those very frequently and commonly. Mask Pitbull, thanks a lot for your comment. I appreciate you. And I miss you guys in LA. If you guys don't know, I trained in LA at Curl and Job, and have some great surgeons and great scrub techs and great nurses all around. So I definitely want to give them a shout out right now. I'm skipping around. If I missed your question, please send me a DM. I can't really get to all these questions. Wookie Shuki says, patella tendon surgery, chances it happens again. So chances that you will tear your patella tendon after having a patella tendon repair, the chances are not extremely high. I would probably put it on the order of less than 10%, but like any surgery, nothing is 100%. The best thing you could do is do physical therapy to recover your strength and work slowly getting back up to your pre-injury level of activity. So Sugar Plum says PRP injection. So for those who don't know, PRP is platelet-rich plasma. It is a biologic treatment that we use in sports medicine frequently, a lot for torn tendons, or very commonly now for arthritis. And it's been shown that arthritis can be improved in terms of the pain with a PRP shot. The downside of a PRP shot is that it doesn't get covered by insurance, so there's a cash price for it. And the way we obtain PRP is with a blood draw. So we typically take about 30 to 60 cc's of blood, which is not a small amount. So you take that blood, you put it into a centrifuge, and that centrifuge allows for concentration of the blood, and you just get the platelets out of that blood. And then we're able to inject that platelet concentration into whatever joint or whatever tendon or whatever injury is present, and that can give the desired effect for healing and pain relief. So just to make it clear, I'm only going to answer questions about shoulder, hip, and knee because that's my specialty. So Logan L says, I had ACL surgery a year and a half ago. What are the chances it could tear again in football? In general, ACL re-tear rate is somewhere around 3 to 5%. Depends on the graft that is used for the surgery. And the main issue is, are you going to be able to return to your same level of play after your ACL surgery? And that isn't always 100%. That is more 85 to 90%, depending on the athlete's pre-injury level of competition. But it is a very low rate of ACL tear in general, but it depends on your age. It depends on many factors. So the best thing you could do is, again, do excellent physical therapy to get your strength, and do not go back before you're fully cleared to play your sport. So someone says, I tore my meniscus, but I'm cleared now, but it still hurts every time I do workouts and stretches. So meniscus surgery depends on whether it's repaired or taken out. The meniscus does take about 3 to 4 months to recover, and provided that you've done the proper physical therapy and done everything to recover, you should not have significant pain when you go back to your sport. And usually I would say to a patient that has pain or difficulty, or the main issue is if you have swelling after a surgery and the recovery, that's when I would be concerned about a possible issue that needs to be addressed. So it's really swelling that would be something that needs to be looked at further after any kind of surgery of the knee. So Ryan P. Holub says, what are the odds percentages that I can be pain-free from a hip torn labrum with CAM morphology with physical therapy? So that's an excellent question. The question really has to do with how effective is physical therapy for hip impingement syndrome. And hip impingement syndrome can be treated successfully with physical therapy, but physical therapy doesn't help everybody. And I can't give you the percentage, but I would say probably less than a third or so are improved with physical therapy alone. So it is worth a try because, again, a third is not an insignificant number. So I would give physical therapy a try for a hip impingement issue. And if that doesn't work, consider an injection for temporary relief. And then if that doesn't work either, hip arthroscopy is a very good outcome that has excellent results in the proper patients. Again, keeping it to the hip theme. I'm sorry, Jackson just asked, I have a hip arthroscopy. So Jackson E says, having hip arthroscopy next week, any tips to recover well and get back to sports at a high level? Again, a lot of these answers I give about recovery are kind of along the same theme of physical therapy. So physical therapy is so key to all these arthroscopic and orthopedic procedures that we do. Hip arthroscopy is no different. Again, follow your surgeon's protocol, but usually you're going to be in a brace after a hip arthroscopy procedure for a certain period of time. You may have limited weight bearing for a period of time, but then within that time period, you're still going to do physical therapy, working on gentle range of motion, and strengthening usually happens several weeks to a couple months or so after the physical therapy initiates. So that is usually what the time lag is in terms of going back to your sport, is that you get weaker because your muscles atrophy, but you need to take some time before you start strengthening because your body has not properly healed yet. Elizabeth Rainford says, is it common later in life to get arthritis in the places you had old fractures? That's an excellent question. Yes, it is common to have arthritis in the places that you fractured, especially if you fracture around a joint. So the problem is that the injury of the fracture around the joint is what initially causes the arthritis to begin with, because any fracture around the joint causes impact on the joint, and that initial trauma actually incites the further arthritis in the future. So yes, that's a good question, and yes, it does cause arthritis usually in the future. Bass Fisher 694020 said, I tore my knee last year and it hasn't healed right and it pops when I walk. What should I do? I can't answer your specific question and your specific issue without examining you, but I would just get it checked out with an x-ray. Usually if you injured your knee or had some kind of big injury to your knee, you at least need an x-ray or an MRI to see if there's any soft tissue damage that can be addressed with physical therapy or surgery. I'm going to skip around. If I miss your question, send me a DM. So Quentin Murphy says, how long should a quad take to heal after pulling it? In general, quad or any muscle injury takes at maximum sometimes 6 weeks. Hamstrings are very notorious for taking 6 to 8 weeks because of the size of the muscle. But big muscles like quads can take about those 6 weeks because muscles need time to, sometimes they actually heal with some scar inside of the actual muscle. And that takes about 4 to 6 weeks to form. But it's important for any kind of muscle injury to take time to stretch and strengthen slowly over time. And the reason for stretching is because, again, these muscle injuries scar as they heal. So the more tight you are, the more harder the scar will form and the harder you will have to return to your activity because your muscles will be scarred and stiff. So you want to stretch as you heal your muscle injury. Lauren says, college athlete here, tore my supraspinatus twice now. What is the risk of a second surgery? So I guess you're asking if you tore your supraspinatus twice, what's the risk of having another surgery? I would say it depends on what sport you're playing. It sounds like if you tore so supraspinatus is one of the rotator cuff muscles. If you tore your rotator cuff at such an early age because you're in college, it is very rare to tear your rotator cuff at a young age, especially in your 20s. So usually that's from some kind of trauma or some significant overhead sport like softball, volleyball. And my question would be, if you are having multiple tears of your rotator cuff at a college level, you either are not doing, I'm not blaming you specifically, but there might be some issue with technique in your sport, or the major issue was not addressed during the first surgery, because a young athlete should not have repeated rotator cuff tears that don't get better over time as long as the physical therapy was followed the first time. So again, I'm only answering questions about shoulder, hip, and knees because that is my specialty. So Anish Bugel said, I had a hip labrum surgery 3 years ago, but it still hurts. Why is that? I can't answer your specific question why your hip hurts, but I would say that in general, a hip labrum that hurts after surgery years later is usually from the fact that the impingement may not have been fully addressed at the first surgery. So usually the reason for failed hip surgery is incomplete resection of the can lesion or the bump around the hip, or other issues that were not completely addressed during the first surgery. So it would be worth getting it looked at again by an orthopedic surgeon and having it evaluated with another MRI or something along those lines. Jordan says, can you fix a torn ACL that was done years ago? I keep blowing it out periodically. If you continue to have ACL instability or knee instability after a torn ACL that was supposedly fixed or was not fixed, you definitely need to get that checked out with an X-ray at least and an MRI in general. So that's my general advice for something like that, or my general thinking on that. So user, some long number said, what should I do for two torn labrums in my shoulder to recover without surgery? So in general, if you want to avoid surgery, physical therapy is your best bet. Sometimes physical therapy does not heal everything, though. That's why we have surgeons like me. There was a good. So Jay McEwen says, can you talk about osteochondral lesion in the knee and the surgical procedure for it? Excellent question. So osteochondral lesion is a lesion in the knee or any joint really that encompasses the cartilage and the bone underlying it. So chondral is cartilage and osteo is bone. So osteochondral lesion is a cartilage and bone lesion. And now we're talking about it in the knee. So what happens is that you have pain because the cartilage is not supported by the bone under it. And then sometimes you have almost a hole in the cartilage and the bone is affected. So you have a lot of pain from that. And the way we treat that, or the way I treat it as a cartilage surgeon, is to make new cartilage or give you new cartilage. So it depends on how big the cartilage lesion is. If it is not a huge lesion, meaning if it's less than 2 centimeters or so, I actually transplant cartilage and bone from one part of the knee to the other, to the part that is damaged. And that's called an osteochondral autograft transplant. If it is bigger than 2 centimeters or so, or if it's too big, you can get the cartilage transplant from another individual or deceased donor. And that's called an osteochondral allograft. And if you have an even bigger lesion, or for some other reasons, you can have a cartilage biopsy and you can have implantation of your own cells after it's grown in a lab several weeks later, and that's called a MACI procedure, MACI. So there's different ways to handle cartilage lesions, specifically for these osteochondral lesions that you're talking about here. Connor says, I play baseball and I have constant pain in my elbow, even with heating, icing, and resting. I would say if you have any pain in any joint, especially elbow pain for a pitcher or a baseball player, rest, ice, and that's still hurting, you should get that x-ray and make sure you don't have a fracture or some other serious issue going on there. Again, if I don't answer your question, just send me a DM. I'll eventually try to answer it. Kaysen says, I fractured my clavicle and had surgery 10 months ago. I went through PT, but there is still pain. If you have had a fracture and have gone through physical therapy and continue to have pain, one issue that can develop from a fracture that is painful months later is that the fracture may not have healed. And so if you still have pain, I would recommend visiting orthopedic surgeon to make sure that the fracture has in fact healed or there is no infection going on. So sorry. Hey, Jay, see you joined. Thanks for joining. Sorry, I'm just skipping around here. Jack Bodie says, I subluxed my right shoulder, and when I hit it, I sublux my right shoulder and I get dead arm and can't pick it up. So it sounds like you're saying that when you dislocate your shoulder, you have a dead arm and you can't pick it up. That's a very common complaint because when you dislocate your shoulder, you actually put the axillary nerve on stretch, and the axillary nerve is the primary nerve that helps you to lift your arm and bring your shoulder away. So what happens when you dislocate your shoulder is that you stretch out the nerve, and the nerve doesn't work properly. So that's common to have some dead feeling in your arm when you dislocate it. Niner Gang says, how long does it take to recover from a patella dislocation? Depends on how you define recovery. Many times for patients that have a patella dislocation, I send them to physical therapy, and that could take about 3 months to recover from that physical therapy and the initial event. Sometimes they continue to have dislocations, and then they need a surgery to stabilize the patella, and that can take about 6 to 9 months to recover from it. So it all depends on the involvement of the recovery process. Excuse me. Just skipping around here. So Drew says, I got full meniscus repair, and it's been 7 months since, and I get weird pains and it pops often. Yeah, it's a very obscure complaint there. Sorry, I can't answer that specifically, but I'd say that it may take several months to feel normal after a meniscus repair. Depends on the extent of the repair and the popping in general. We, as orthopedic surgeons, never get that concerned about popping in a joint unless the popping is painful. But if it's non-painful popping, it's most likely from scar tissue or some kind of tissue growth. If you have pain that doesn't interfere with your activities and you're still able to do what you want to do, I would see if you can just carry on and return to your sport without worrying about it. I have about 5 more minutes here before I have to go. Chris Sturm says, hip avulsion at 17 with mild labral tears as a rugby player. Should I be concerned for my future? So the main issue for future hip health is the labrum tears. And there's good evidence that if you have hip impingement, meaning if you have a cam lesion or a bump on your hip and labrum injuries, you may have an issue with arthritis in the future. It doesn't guarantee that you're going to have arthritis, but you may have a higher likelihood of arthritis with that combination of injury. So it's something to keep in mind. If it still bothers you, if you still have hip issues going forward, you may want to get that addressed. A Timotei says, hey doc, I had ACL surgery in the recovery 2 weeks ago. So ACL surgery 2 weeks ago, what do you recommend for fast recovery? Again, depends on your specific surgery, what they did. I can't answer that obviously because I wasn't your surgeon, but the best thing to do after an ACL surgery, if it's just an ACL, what I tell my patients is to get your range of motion. Range of motion is vitally important for ACL recovery. You have to get full extension, and that's almost more important than full flexion in the beginning, because if you don't get full extension, you're not going to be able to ambulate or walk properly. So the most important thing is to get your knee straight and get your knee bent within those first couple of weeks. If you don't get it in the next couple of weeks, it's not a huge deal, but definitely make sure you focus on range of motion. That's the most important thing you can focus on in the initial phases after an ACL reconstruction. Do you have a good Arthrex rep? Yes, I have a great Arthrex rep. His name is Brian. Official Jackson said, just got labrum surgery. Can I return to football? There's good evidence that you can return to collision sports after labrum surgery. Just depends on how significant your injury was and if you had bony involvement. If you did, you have a likelihood, unfortunately, of having another instability event. So it depends on the extent of your tear and the extent of the bony injury to the shoulder. Brigaria says, can you get hip avulsion fractures from growth plates at 16? Could you feel the pain in your groin? So you can get what you call an avulsion fracture it's the top of your pelvis. That's very typical to happen to a lot of sprinters. And you could feel it in your groin area, I'd say, but it depends. I'm not sure what your question is referring to, but it is possible to get a hip avulsion fracture at 16, especially if you still have open growth plates at that age, which many 16-year-old boys have at that time. Okay. All right, so I have time for like 2 more questions. So Noah Jervik says, what would you do to prevent hip labrum tears when you have hip impingement? The best thing you could do is, again, physical therapy to work on basic hip mobility. And sometimes you really cannot necessarily prevent the hip labral tear because the impingement is the problem. The impingement is like a bump on your hip, and that causes tearing of the labrum as that bump hits the labrum of the hip. So unfortunately, there might not be much that you can do. So I have one more question. Again, if I missed your question, please send me a DM. Sure, I'm happy to collaborate on a project. Just send me a DM. Sorry, guys, just one more question. So I'm going to say, so someone just said, what are my favorite cases to do? Okay, my favorite case to do is ACL and rotator cuff surgery. So ACL is the knee, obviously, and shoulder is the rotator cuff. So I like ACL reconstruction surgery because it's a very individualized surgery where I tailor the surgery to the particular patient, their particular activity level, the sport they play, the time of year it is. So I like that part of sports medicine surgery. And I like rotator cuff surgery because they are pretty fun to do. And I can do them relatively quickly at this point. And it is a interesting procedure in general. So sorry to cut everyone off, but I have to get going and to my next appointment. So I hope to do this as a weekly thing. So please join me. Please follow me if you're not, and I'll try to answer questions as they come. And I'll catch you guys another time. Sorry I had to cut this off now. See ya. Bye.